Well, good afternoon, everyone, and thanks for joining us here. I'm Sean Egan, Deputy Director for Labor for Michigan's Department of Labor and Economic Opportunity, and this is our sort of recap, wrap up for Mental Health Awareness Month and our ongoing webinar series focusing in on workplace mental health. For those of you that have joined us for the whole month, we've appreciated it. You know, we do our regular webinar schedule, which is one per month, and we'll be back to that in June. We're going to have a great discussion with an expert on how work, young people working. It's Youth Employment Month in June. Young people working and impacts that positive and negatively to their mental health when they're at work and learning how to work as young workers. So that'd be pretty cool. We'll be back on the normal flow in May. Because it is Mental Health Awareness Month, we try to do more. So we've done one webinar each week, and we've been pretty excited about the content. So for today, you just get to hear from me. I'm going to share with you kind of a recap of what we did this month, what we've been doing the last couple of years, and kind of where we think we are going with the work that we're doing here in our Michigan Department of Labor and Economic Opportunity, focused in on workplace mental health. As you know, there's a Q&A box on your screen. You can submit questions at any time throughout today's presentation. Definitely get to as many as we can. We'll probably have more time today. If we do get done early, that's good because it's beautiful outside. It's Memorial Day week, and hopefully you'll get to enjoy some of that weather that we're having today and tomorrow because it looks really pleasant. And if you haven't already, please make sure you sign up for emails and other information from us at michigan.gov/workplace mental health. That's what we call our resource hub. In government parlance, that means it's a web page, but it's our resource hub, and we do a lot of things there to try to keep things updated. So this recording, all of our previous webinars, including those we did in May, are there. So if you want to get back to those and check them out, everything is there, and we continue to update resources and links to other information out there. And as you know, our goal with all of this is really to provide working people and employers with information about impact issues that are impacting our workplaces, including the impacts to our mental health and some options or tools for addressing those issues. And we really focus in on three pillars, and I'm going to talk a little bit about more of those in a couple of minutes, but these pillars of things that are happening in the workplace, things that are affecting the workplace, and options, individual behavioral health supports, and some of the things that we can do in each of those areas. So all of our webinar series really focuses around those three pillars, and that's what those topics kind of lean into. So we always talk about systems because it's become quite clear to me over these past couple of years that we really, as much as we want to and we do focus in on individual behavioral health supports, which are critical, we can't really fix it all unless we're looking more broadly at the different systems and problems and challenges that are impacting us more holistically. So we are going to continue to do that. But this month, we had a great webinar series for Mental Health Awareness Month, and we kicked it off with Marty Bledsoe, our friend and CEO of Apparently, and she talked about how our children's mental health is impacting us in the workforce, or impacting the workforce, and the stress it creates for workers, how it comes into the workplace, the need for flexibility and time, and certainly the challenges of helping your child deal with their own mental health issues. Then we had Nikki Gable from the Michigan Public Health Institute that talked about recovery-friendly workplaces, a program that was developed out east that's come into Michigan to help those that are overcoming certain addictions, particularly opioid addictions, and making sure that we create workplaces that support that ongoing recovery. We had Fatima Salman and Dwayne Brajak, both social workers, both part of social worker associations, that talked to us about how we help the helpers. Social workers, as we learned in that webinar, are probably the largest group of workers out there that are engaged in certain mental health supports and issues. So making sure that we support them in their work so they can help us is a critical issue that we covered. And then we had Danielle Atkinson, the founder of Mothering Justice, as well as a commissioner on our Michigan Women's Commission, and a couple of guests that talked to us about caregiving and the needs of caregivers, whether that's children, elders, other family members, or others that you're caregiving for, and the needs in the workplace, such as more flexibility, perhaps time off, perhaps more tools and resources. So all of those are really good. And before I get too deep into what I want to talk about more today on where we've been and where we're going, I did want to give a special shout out to the folks that helped put all of this together. And first and foremost is Brandy Woodbury. She's a person you're never going to see because she doesn't want to be seen. but she is the person that dives into and pulls all these great guests that we have for all of these webinars that we do. Sometimes we just come up with a concept and she'll go find somebody that does that stuff. And she did that for this month and really brought in those experts that we relied on for all of the great topics, including June, including August, including September. Like, she's the person that goes to. She's also running this live presentation for us and really just truly probably the linchpin of making sure that we continue to provide great content to you all. And certainly our communications team, but Beata Kitsa and Erica Quayle, who often does our Q&A, they're the ones that are sending you all those nice tools. And then we got our good friends, Michael Snyder and Jeanette Rico with graphics and video that get all those nice trailers to you. And I just wanted to take a moment to just thank them so much for their ongoing support for this work, as well as making sure that we have great content for you all. So why Leo Labor and how did we get here? So first and foremost, we started a couple of years ago. Governor Whitmer, during her 2022 State of the State address, talked about mental health. And what the governor was talking about in 2022 was the need for, or lack thereof, community mental health resources, recognizing as we were coming out of the pandemic and how our psychology as a society kind of functions through natural disasters and pandemics, as well as better recognition of the need for mental health support, really focused in on the concept in community mental health supports. As a Department of Labor, we took it upon ourselves, thanks to our director, Susan Corbin, and myself. She came up with this question of like, what's going on in workplaces? And we spent a couple of months with a group of experts, big business, small business, labor union folks, other workers, and a bunch of experts, and kind of dove into data to try to identify if there are issues in workplaces, what do the issues look like, and what's causing those issues, and what are things we can do about it. So we spent a couple of months doing that. And then in June, almost 2 years to the day, end of May, beginning of June, we launched our workplace mental health report. You can find that again at michigan.gov/workplace mental health. We have both our report as well as the later issued, we like to brag about that, later issued Surgeon General's report, which are pretty close in scope, duration, data, you name it, and tools and resources that we can use to focus in on mental health. And we had 9 recommendations from that work group to us as the state of Michigan, and then we had a couple of handfuls, or we had a handful for employers out there. So for those directed at us as the Department of Labor or the state of Michigan, one was to be a model employer. So we're doing things internally with state of Michigan employees with different types of training opportunities, different types of focus, some survey things, some benefit things, making sure people know where our ESP, we call it, or EAPs, as many private sector employers call it, where those resources are, how you get to them, and all that kind of fun stuff. So we're trying to make that happen. And then a couple of the other recommendations that came from the work group focused in on us as a state of Michigan included developing a resource hub, providing learning opportunities, and some things like that. And we're getting to a few of these issues. Certainly the resource hub, michigan.gov/workplace mental health, and then learning opportunities like this one. We are going to take that deeper. I'm going to talk to you in a few minutes about other things we need to be doing, or we're trying to be doing around these recommendations, but this is really what guides our work. All of that's in our workplace mental health report that came from the department. And this is what is telling us what to do. So we have some more immediate needs and we have some more challenges. One of them on here is to develop Michigan specific data. One thing we saw really quickly when we were doing the work of the work group was that pretty much all the data is national, and kind of the only thing you can sort of say is that there's no reason to believe that Michigan's any different than any other state, which is relatively true. But we looked around, we started talking with experts around data to find Michigan specific data. And for what we needed, it doesn't really exist. So that's something we're continuing to try to create and try to develop. And then we had a handful of issues for employers out there that were sort of like what we called steps to get started. And we'll cover those a bit more in a minute. And there's a couple other things there to make sure that we identify employers that are doing great, and that we provide different types of resources, and that you consider sort of grants if you need to, or something like that. So we're working through all of those issues that the work group recommended. But first and foremost was to get the word out, spread the message, fight stigma with your help, and make sure that we are engaging with workers and employers across the state of Michigan. And we're doing that quite well. We not only do the monthly webinar series, we've done 60 plus speaking engagements last year. We're on pace to beat that this year. That's with labor, with employers, with associations, with whomever wants to listen to us talk about workplace mental health and why work is the place in our mind as the intervention point where we can have a big impact. So we're continuing to move that forward. And as I talk about quite often, we really focus in on these three pillars. And you'll see all this on our website as well. But we talk about in the workplace, which we believe is really where Leo will focus most of our time, those things affecting the workplace, and then that individual behavioral health support. And this is part of that broader system that we have to put together. So we have examples of each of those just sort of listed there. That's not an exhaustive list. It's just kind of things we came up with in different in the work group and then through our different experiences where when we're talking about in the workplace, the example I used with the work group all the time that we discussed was sort of nurses. I think we hear a lot in the news about the challenges nurses and other medical professionals, but anybody in medical care is really facing with short staffing, excessive hours, the trauma they endure because of their work and how that impacts their mental health, the lack of time off. But that's true around a lot of industries. And we've heard a lot of stories from working people and employers about the challenges in their particular sector related to things happening in the workplace. Also on that list, but not listed here, would be things like workplace bullying and harassment, other issues like that, maybe not a constructive atmosphere that can really have an impact on people. And then we get into things affecting the workplace. And the way I picture this is those are things that I'm bringing with me. So if I had adverse childhood experiences, certain numbers, like if the more you have, the more challenge you're going to have. If I endured poverty, if I endured racism, all of these things have a developmental effect on all of us as individuals. So if you endured adverse childhood experiences, which certainly can include poverty and racism, it's possible that your stress response has been changed and the way that you deal or cope with stress is going to be different for you than it would for me. And we've all had somebody we worked with or a friend or a colleague or somebody we've been around where we both see something happen and it feels to us like that other person's response was probably a little bit much for the situation in front of us. And part of that's because of different life experiences. So if you had adverse childhood experiences, you might bring a different stress response to the workplace. So employers and coworkers need to understand that there are going to be sort of differences, and there are, right? Differences for all of us based on our life experiences that are going to impact how we work, where we work, when we work. So we talk about things like trauma-informed workplaces, understanding how different traumas in people's lives have affected them and what that can mean going forward. One of our great guests, Vicki Coitz, who's helped us a ton on all of this work, is a trauma-informed expert. And she talks about how she dealt with some adverse childhood experiences, went into the workplace, had done therapy, had done all the stuff, and ran into a boss that was a bully, and it re-triggered that trauma for her. She never expected it. It just sort of happened. And I think one thing that she'll tell you is the challenge with that is when that gets re-triggered, it's almost like you are immediately back where you were in your thinking. So it made it really, really challenging. She had to seek help again and do some other things. And then certainly that individual behavioral health support. We've been working with our Michigan Department of Health and Human Services all the way through this work. We're going to continue to do that. And we have great partnerships with others that are focused in on the individual behavioral health support. That is not something that we see Leo Labor taking the lead on. There are a lot of great groups. That's what they do. They know how to do it. They diagnose, they find help, they do supports to help people develop and get through different mental health issues they may be enduring, whether that's therapy, medication, or just something else. There are great groups that do all of that kind of stuff. And that also includes that concept of wellness. So when we do talk to employers, there are a lot of wellness tools. So you think of those things like chair yoga or different tools that you use in the workplace to kind of cope with the stress you're enduring. Those are all focused, that wellness concept is focused around the individual. So those are crucial, those are cool, and they're important, but we want to make sure that we don't lose focus on the system because all of these things run together. And probably if you've joined us at all, you've heard me talk about this a million times. The most eye-opening thing for me in all of this work was this concept of stress. I've been around for a while. I know I look incredibly young, but I've been around for a while. And I've been to different conferences where we talk about stress. We hear a lot of talk about stress and how to manage our stress. What I didn't really understand from any of those was basically what the stress response is and how it's connected to all of those other things that we talked about for both the trauma informed, the individual behavioral health support, and those things in the workplace. So this really is becoming sort of our North Star, as you will, for workplace mental health, to recognize the impacts of chronic stress, to try to mitigate chronic stress, and think about our work and where that stress is coming from. So what happens in your brain when the stress response is activated is that little thing there, the amygdala engages. Now we know that some stress is good. I always joke, if you tell me I have 3 weeks to do something, I'm not starting for about 2.5 weeks, right? I need that little bit of stress to drive me, to focus me, to get me to finish something, to get me to finish a project. But if that lingers, if it's too excessive or too long, it doesn't have to be a lot of stress. Duration matters. My stress response is activated. And once that activates, it triggers your hippocampus, which is this other part of your brain that stores emotions and memories and other things. So what I usually share with people is that if you endured some kind of stressor, an adverse childhood experience, all of that stuff is stored here. And however you responded to that stress before is more than likely how you're going to respond to it now. But more urgently is it disengages your logic center. So we know that our advantage as humans is our cognitive ability, our prefrontal cortex, where we have rationality and we have logic and we can think through and solve problems. But when your stress response is triggered, it disengages your logic center. So you're not really responding as Sean, the logical person, if you would agree that I'm logical, the logical person. You're responding as Sean, more likely the emotional person. So when that stress response is triggered, we always hear about like fight, flight, or freeze. There's a fourth one called fawn, which is to submit. That's where all of that is coming from. And it was important for our evolutionary development because it keeps us safe. When there is a real threat to our physical health and safety, that stress response activates and it basically tells us what to do and gets us out of trouble. And then the stress is supposed to, once it's gone, everything turns off and it heals. It also releases all that adrenaline and cortisol through your body. It enlarges your organs, gets you ready to flee, right? We understand that. If that continues, though, we start to have real longer term impacts. But first and foremost, everybody just has to understand the stress response is automatic. Somebody is not choosing to disengage their logic center. Once the stress response activates, it's on, autopilot's not quite right, but it's close. It's basically going to take over control for the most part. And it's going to cause some real quick responses. And those things would be like possibly pain, brain fog, confusion, fatigue. You're going to get numb. You might start disengaging, like your logic center is not engaged, right? And it's automatic. You can't control this. I can't control this. And we're all wired the same exact way to kind of deal with this. So it's important that we remember, if nothing else, too much stress is bad. Stress response, we got to deactivate that stress response. And it's automatic, the response that we're going to have. And if it extends for a longer duration, we actually have real physiological changes for our physical health as well as our mental health because it's doing damage to our bodies. When we have, well, I think we all know that, right? Cortisol, you read about it all the time, not good, not good for you. Adrenaline, too much adrenaline, not good for you because it enlarges everything. So you can have real physiological and physical changes to your body if stress is prolonged that are going to cause significant poor health outcomes or lead to other things. So you can get things like hypertension, heart disease, diabetes, you name it, because your organs are really under stress. But it also pushes people toward addiction. And the most common outcome of chronic stress is anxiety and depression. So we think about all of the depression that we're talking about all the time in the news. About a year ago, or maybe a little longer now, Stanford Medicine actually said they could probably tie 40 to 50% of the depression that we see in our country to genetics. Now, I'm old enough where if you heard the word depression, you always assumed it was genetic. So hearing that 50 to 60% of the depression in our country is coming from somewhere else, tells me that we want to talk about systems. We want to identify those stressors that are pushing people towards poor health outcomes, because logic center is disengaged, right? You're responding emotionally. You're going to find some way to cope with the stress that's in your life. So a couple of things we've done, of course, is launch the Resource Hub, and you'll see all of this in our report. We have a long section focused on stress, and OSHA is also focused in on workplace stress. And they have some other great guidance, tools, and tips for the workplace where we focus in on the concept of stress. And what you'll get into in our report, in the Surgeon General's report, is that stress, that chronic stress, those things that are impacting people on the daily or prolonged periods, are really causing these poor health outcomes, the depression, the anxiety, the things that we're seeing and dealing with. And it's just critical that we continue to focus in on that. And one note, resilience. We hear a lot about resilience. Resilience is really, really important. Resilience is learning to choose a different outcome when the stress response is activated. And the way I always describe this for myself is, I might not be able to tell what the stress is, but I can tell that I'm stressed. So instead of reaching for maybe the beer, I go for a walk, or doing things that aren't good for my health, I choose something else until I can figure out how to manage that stress in a more healthy way. You can do that. You can learn how to do that. But the thing that we heard from the experts when we put the report together was that we have to do them together, because even if I learn how to be more resilient, if I'm continually put back in whatever the chronically stressful situation is, it's not going to matter if I'm more resilient, because that stress is still there. So we have to kind of tackle both issues at the same time, identify the cause of the stress, find ways to mitigate or alleviate that stress to the best that we can, and learn to be more resilient at the same time. So the example I always share with this when I'm presenting, and I am presenting, I guess, is people living in poverty. If you're living in poverty, you are chronically stressed. And if you learn to be more resilient, that is wonderful. But if we don't escape poverty, we're still in the chronically stressful situation. So we're still in a cycle where the bad outcomes are more than likely going to occur, because the chronic stress is still going to be there. The way that we deactivate the stress response is to get away from the stressor. So for all of us watching this at work that aren't taking enough time off, take that time off and do all the things that you have to do to take care of yourself, because you just can't function that way. So we did a lot in our report. You can find more there of like why the workplace. Well, that's where the people are. That's where we are in the majority of our waking hours. And real or not, that is where the majority of workers continually say the number one stress in their lives is coming from. And you can think of that again, going back to that concept of in the workplace, things like excessive overtime, understaffing, low pay. Surgeon General points that one out. Other issues are causing stress for workers, and that's having an impact on the bottom line. So I cut out our really long, ugly slide about how much that's impacting the bottom line. But in our report, you'll see information in there from Tufts University about the costs that that's having that aren't necessarily in the spreadsheet. So people dealing with anxiety and depression are still going to come to work. They're just going to be less likely to be able to perform at the highest level. So it's going to impact the bottom line, and there are ways that you can adjust that. And the good news out there for employers is focusing in on mental health not only gives you a $4 return for every $1 invested, people are more likely to stay, 70% less likely to look for another job. They're more likely to advocate for you as the place to work. They're going to be experiencing less burnout, which is good, because burnout is kind of that chronic stress situation. Logic Center is not going to work properly. They're going to be thriving in their own lives. They're going to be engaged at work. All good news. All good news for employers out there. So where are we going, I guess, is we're going to continue to do our webinar series. We're going to continue to build out the Resource Hub, and we're continuing to focus in on this concept of consultation. So we, in the work group, you see this in the report, identified two models out there. One was in Illinois and Chicago, corporate-led model where they focused in on trauma-informed workplaces, and then the New York City of New York model where they did actual employer consultation programs to identify stressors in the workplace. And our group liked both of them, and we like the idea of merging those together and then pulling in those other partners. So we really look at like an organizational psychology focus from Leo, tied with our many partners at the University of Michigan, Michigan State, Corporation for Skilled Workforce, You name it. We got partnerships with groups all over the country now, and all of them in Michigan pretty much that are focusing on this space to do the things we shouldn't be experts in, like trauma informed, adverse childhood experiences, individual behavioral health supports, and do that through sort of like a peer group and cohort model where we get into workplaces, engage employees and employers, and find ways to deal with whatever's going on in that particular industry. And we want to focus in on several of the other recommendations from the work group that have been a challenge for us so far. One is an industry focus. What I thought was one of the more critical pieces that we were going to focus in on was taking our work group and then breaking into industry sectors. So that concept of healthcare, manufacturing, construction, production, all those kinds of stuff. As you know, we have a specific focus on construction industry suicide prevention. We want to build out into other industries, not to start with the data all over again, but identify anything specific to that industry that's happening and start looking for ways to change that, to fix that, to remedy that. And then other developing Michigan data and other things that we can do in Michigan specifically to kind of help move this work forward. And throughout our webinar series, we've had a lot of great guests, and we're focused around the different pillars. Click the QR code here or go to that website I keep talking about. You can get right to our landing page and get to our mental health report. We've had webinars focused around techno stress and how that's affecting us in the workplace. We've been around the shortened work week. The folks from Cambridge that actually are doing the shorter work week study came on with us last year in May to talk about the results and why that's having such a big health impact for working people. And then predictive schedules. And then we get on things like individual behavioral health support and trauma-informed workplaces. So you can find all of those on our website that we've been doing, and we'll continue to do that. And we're also working to develop out the program proposal and other models to make sure that we are hitting the things that are just critical for workplaces around the state of Michigan. So with that said, we don't have any questions in the queue, which I sort of appreciate, I think. So if there are no questions coming in, I think that I have said all that I wanted to say. I hope that you've enjoyed, for those that are continuing to follow us on our workplace mental health journey. I hope that we're doing well. Please give us feedback. We're definitely trying to make sure we hit the mark, make sure that we're identifying different tools, resources, or issues. It has been a little bit like turning over rocks at times and trying to find the right pieces to fit together. We do know that there are a lot of resources out there, so it's very difficult to kind of identify the ones that might make sense for you. We want to make sure that we're trying to do that as well. So that's why we keep mentioning the resource hub that we have. And we're going to continue to move it forward and develop out a program, get the consultation stuff going, maintain a focus on smaller employers, and make sure that we're continuing to build a stronger Michigan together. So I appreciate all of you for joining us today. There is a survey form in the Q&A box if you want to fill that out for us. And we look forward to seeing you in a few weeks in June when we get back to our regular once per month. And we're going to talk about young workers and kind of how that impacts their mental health. So thank you all for joining us today. And I really appreciate the continued support.